Welcome back to Twin Cities Live. This is kind of a shocking statistic.
It really
Did you know
is.
this? 2 out of every 3 people over the age of 65 have a cataract, and they develop as we age. If you've noticed that your vision has started to get a little bit cloudy, it might be time to consider eye surgery because you can get those cataracts removed.
Yeah, so 66% of over 65. Is that
Good
right?
job on the
Is that
math.
how the numbers work out?
Amazing.
Yeah.
Wow,
That's an
Ben
easy way to
Leber.
remember. If you're
You're not
over
just a
65,
football
it's
player.
basically 66%.
Brilliant.
All right, so here to expel and exorcise the demons of these common myths about cataract surgery is Dr. Chu from Chu Vision Institute. Hello, Doc. How are you?
Hi, Ben, Elizabeth.
Good to
Nice
see
to
ya.
see you. Listen, Dr. Chu shows up in scrubs, and then we all are like, look at your kicks. Can you, what are you going to flex move? Show these
I'm going to
sneaks?
flex a little bit.
I did my sunglasses on. Those are bright.
The sneaker game, you appreciate
Yeah,
it.
you
I
look
do
cool.
appreciate
Those
it.
are sweet.
Oh, yeah, fresh, real fresh.
Real fresh. And I'm assuming very comfortable, right?
Super comfortable. Yeah.
Because you're on your feet a lot all day long.
You got to go in style.
Yeah, yep,
Yeah,
and you're
yeah.
ready to go.
Very comfortable.
Okay,
Absolutely.
so we got a little fact or fiction game. We always
Thank you.
like doing this with you. And this is interesting. A cataract is a growth on your eye. Is that fact or fiction?
That's actually fiction. It's actually a changing and cloudiness inside the lens of the eye. So it's not a growth, you know, it's not something that's new. It's just an aging process.
Okay, I see. I always thought it was something that grew because when I see it in dogs, it looks like that.
Yeah, it gets its name. Cataract is like a white waterfall. So if we let the cataract get cloudy enough, it turns into a white sort of opacity. So it's a growth inside the lens of the eye, and it scatters light and makes things blurry.
Interesting.
Oh, I like the fact that you dispelled that because I always thought the same thing. I thought because you can actually visibly see it. I'm like, well, that's got to be something that's growing inside of the eye or on top of the eye.
So many people, though. 2 out of 3 over the age of 65. That's a lot.
Yeah, it's good for business.
That's a good way to look at it.
You got kicks to buy.
All right, so number 2, the main symptom of a cataract is cloudy vision. True or false? Fact or fiction?
You know, yes, cloudy vision is one of the first signs.
Okay.
You know, you actually start losing vision in low light conditions. So you might say, like, you know, I need more light to read. It's harder for me to drive at night. I see glare and halo on oncoming headlights. Those are some of the earliest symptoms before you start having blurriness and not being able to read and do your daily activities.
So we were seeing that image, and you could see the first image was really cloudy and blurry. So this is sort of a simulation of what it might look like for someone who has a cataract.
Absolutely. Yeah, and it would even get dimmer because it's almost like having a pair of sunglasses grow inside the eye.
So the blurriness would improve, and then the brightness would improve as well.
Colors improve. First thing that patients notice is that the vibrancy of colors. They always say blues are bluer, whites are whiter. They love that.
So the world is more beautiful, really.
The world is more beautiful. Sometimes they're looking at it like, oh my God, I didn't know I had to clean my house because there's all these dust bunnies around and stuff. But, you know, there's good and bad. There's good vision.
So if you don't want to notice the dirt, don't get the cataract surgery.
Yeah.
Okay, all right, we got another fact or fiction. Once I have a cataract removed, it can't come back. Is that fact or fiction? Boy, I hope that's a fact.
It's one and done. So that is true. Once the cataract's removed, it doesn't come back. So we're removing the cloudy lens, and we have artificial implants that replace that.
Oh, so those implants will never get clouded over, no matter what.
Exactly. It's a one and done. They've been around since the 50s. They've improved over the last, 60, 70 years. But there's so many options with those, and that's what's exciting.
What if you live another 65 years?
It still goes. So yeah, that's right. Yeah, then let's see. Yeah, we'll see.
Maybe.
We'll see.
I suppose.
The first person to live to 130 is
Yeah, I
gonna
mean,
tell us.
maybe they need another surgery when they're 130,
Okay, that's
135.
It's rare, but we have done, say, genetic cataracts on younger, adults.
Okay.
And those, age 18, 20, and then they'll last until, throughout their life.
So would you say it's one of the safer things, like, because as far as with any surgery, there's a risk. With any surgery, there's a risk that maybe your body isn't going to like what happened. Is this overall pretty high on the list of safety?
Yeah, statistically, most patients are, Medicare patients. So if you look at that data, it's not only the most commonly performed surgery in the United States, but it's also the safest surgery performed in terms of complications and things.
Okay, that's really good to know.
All right, let's go on to the next one. Number 4, will I need reading glasses after a cataract surgery? Is that fact or fiction?
So nowadays, you do not.
Wow.
So this is one of the big things that many people probably don't know is that we have those implants now that give patients options. They can see distance, computer screen, and reading. They have many choices, whether you've had LASIK surgery or not.
Really?
We have implants that can give great vision for distance, for near, depending on what the patient's needs are.
So you're
That's
really
amazing.
giving somebody a brand new eyeball, like a brand new lens, because you're not only getting rid of the cloudiness, we talked about the cloudiness and the brightness and all that stuff, but because I'm getting to the age where I kind of have to do this a little bit. I don't think I need readers quite yet, but things up here, super blurry.
Yep.
So if I got to that point, I could have these all the way up here like normal, like I'm a teenager.
Absolutely, yeah.
What a life.
What a life.
We're turning back the clock. You
Yeah.
know, so now it's not just the medical process where you're taking out the cloudy lens, putting an implant in. It's actually like refractive surgery, like LASIK. We get to know who you are, what your needs are, and then we try to customize what we have available. And so having all the choices available is what's key.
That's so interesting. Okay, do you find, I want to ask you this, that a lot of people maybe because the shift happens so gradually that you don't really notice, oh, it's a little bit darker, it's a little bit blurrier. Do you find that some people come in and don't even realize that they have the cataract and you've done an exam?
Yeah, a lot of times they go to their primary eye care provider, they're looking for glasses, and all of a sudden, you know, they're discovering, hey, glasses won't really help this anymore, it's time for surgery.
Okay.
But one thing that's important is when they're looking around, they should really, you know, as a surgeon, we have the most options for you as a patient the very first time you do it, right? It's heartbreaking when somebody comes in, they've seen this show, and they say, you know what, I'm not super happy with my choices or my results.
Yeah.
Can you help me? And not everybody can always be helped the second time around.
Okay, so who you're choosing to do your surgery is very important. And what
I think it
matters.
is. I think you want somebody who's really good at talking about all the options, has access to all the options and latest technologies, because it's really the first time is your best time.
Yeah, and somebody who has good taste in shoes.
Well, that's the other thing. I mean, you might come in and you may like, oh, those shoes are kind of like, oh, they're cool.
Ho-hum.
But you walk out of surgery and you're like, whoa, didn't realize you had such banging
If
shoes.
these look yellow to you, you should come in and see us. Because these are supposed to be white.
Dr. Chu, thank you so much.
you're
We
the
love having
best.
you here.
Thank you.
All right, head over to chewvision.com to schedule an appointment with Dr. Chu. We posted that link on our website, twincitieslive.com.
Now every patient's going to expect him to have killer kicks, so he better get a new closet. Coming up after the break.